Hi, this is your Houston chiropractor and ChiroTrust member, Dr. Gregory Johnson, and we have Will here with us this morning. And Will was referred to us from the Houston VA because he's got a lot of issues that he's had happen since his 2 deployments overseas in Afghanistan and Iraq, right?
Yes, sir.
I want to thank you for your service, by the way.
Appreciate it.
Appreciate you too. Now he come in here complaining of a lot of neck pain and shoulder pain and sternoclavicular pain up here. He got in a car bomb and the vehicle landed on his head and jammed all his shoulder and neck up together, right?
Yes, sir.
And then he's also had pain down in his low back and in both knees, both shoulders, and a little tightness and soreness, not just a little, but all these other things are overriding it, but he's got some mid-thoracic problems as well. So I've already done his comprehensive orthopedic neurological evaluation, and I'm not going to do all that over again, but we are going to show you a few highlights. Let's say you flex your head forward and backwards again. And you feel a little kinked up there, don't you?
Yes, sir.
Especially when you go backwards.
Mm-hmm.
Yep. And I can tell he's a side sleeper. He turns his head to the left mostly when he sleeps.
Mm-hmm.
Yep. See how his hands are out in front of him? That's because his head's forward and pulling his shoulders forward, and that also kind of pinches on that sternoclavicular joint right there, as well as affecting both of the acromioclavicular joints up here in his glenohumeral joints, which are his shoulder joints. So go ahead and just sit right here for a second. Well, I'm just going to show him a couple of highlights of your orthopedic exam. So when I did a straight down compression on his head, he said that didn't hurt the first time. Did that hurt that time?
Mm-mm.
Okay, so now I'm going to go backwards and right and down. That's called a maximum foramina compression test. And where did that hurt?
Back here.
Right. Now we're going to go back and left and down. And where did that one hurt? Same area, huh?
Mm-hmm.
And then this is called a shoulder depressor test. I'm actually checking his lateral flexion and his cervical spine, but then I kind of push down on his shoulder. Does that tighten up in here?
Just a little bit back here.
Yeah, so that's a positive shoulder depressor test. I'm going to tilt left. See, it's harder to go that way though, isn't it?
Mm-hmm.
Does that tighten up on the right when I do that as well?
Not too bad.
Not as much? Okay, so that would be considered a negative shoulder depressor test on the right side. Now I tested his strength and his strong on deltoid, bilaterally. I checked the biceps, triceps. There we go. Those are all good. His reflexes were +2, equal and active in his upper and lower extremities. So let's lay you on your back for a second. Now I'm going to show you a couple of orthopedic tests that are meaningful in his case. He's been having hip pain on both sides, but worse on the left. This is called a Fabry-Patrick test. Bring this leg up here like this. Now, I'm going to apply pressure on his distal femur downward. Does that hurt in your right hip joint?
Right here, yes.
Yep. So that's a positive Fabry-Patrick test on his right hip joint. I already did straight leg raise on him, and that's negative. Okay, now I'm going to push down here. This one's worse, isn't it?
Mm-hmm.
In that right hip, left hip right there?
Mm-hmm.
Okay, that's a positive Fabry-Patrick test on the left. Now we checked his strength here too. Push, pull up, turn in, turn out. Push, pull up, turn in, turn out. Good. Okay, I'm just going to do this over just to show him. This is a straight leg raise test. See, I bring the toe back. And if he had a herniated lumbar disc, this would be positive if he had pain in his low back and shooting down his leg, which you do not, right?
No, sir.
So we bring it down here halfway and do that. That's called a Braggart's test. That didn't hurt either, did it?
No, sir.
Okay. So we're going to test the strength on this side. Push, pull up, turn in, turn out. Good. We're going to do a straight leg raise here. Again, there's no real sharp low back pain or shooting leg pain, just tightens up in the hamstrings there, right?
Mm-hmm.
Okay. So now we know that he doesn't have pathology in his lumbar disc that's creating lumbosacral radiculopathy. He has biomechanical improprieties or subluxations in those regions. Let's go ahead and turn back on your tummy again, Will. Now this is a really important test, and don't let anybody tell you that it's not, because this has to do with the cerebellum and biomechanics. Now, in looking at his leg length, I don't look at the heel. I look right where the sole and the heel meet here on his shoes. And you can see the left one's shorter by 1/2 inch. Now, as I bring those up, see, you can already see it getting longer. And that causes pain in his low back and pelvis right there. And his leg gets 1/2 inch longer there. Did you feel that, Will?
Yeah, back here.
Right there, yep. So he's got bilateral SI joint tenderness when I palpate there, L5 tenderness there. He's got L3 and 2 on the left up here. These are all sore though, aren't they? Mm-hmm. And that's real sore right here.
Yeah.
He's got palpatory tenderness at T5, 6, and 7. He's got costovertebral subluxations or misalignments in his mid-thoracic spine that go all the way around into his sternum. His neck's out right here on the left, which is causing cervical brachial syndrome on the left. Right there on the right. And then his atlas is subluxated right under his skull. Now this is also an important test that I did that we found out that he has a sacral deviation. Go ahead and lock your right leg straight, lift that whole leg up. Now see, he has a really hard time doing that. Okay, relax that one. Same thing on the left. See, he has a hard time doing it on both, but you notice his left one doesn't come up as high as his right one. That's where his short leg is, so he has a left sacral deviation right there too. So I'm going to adjust him on the BioPhysics table here first. I've already looked at his MRI findings, which he brought in from the VA, which if you're coming in here from anywhere and have diagnostics, I want you to bring those. Straight superior to inferior and a little bit lateral on the sacrum on the left. And now I'm on his left SI joint and hip. Now I'm going to adjust the right side of his sacrum, straight superior to inferior. On the y-axis, his right SI joint, he has an internal rotation, so I'm adjusting it externally and at a 45-degree angle. And then I'm on L5, right there. There's L4. There's L3, L2, and L1. Now, just keep breathing, Will, and relaxing. Good. Oh yeah. Our crack addicts worldwide are gonna love you. There you go. Good job. Now we're gonna recheck this. I always do post exams too. His legs are exactly even, and Will, I want you to tell me if this tightens up as much as the first time I did it.
Nope.
Now see, his legs stay even this time too. Okay, so I'm going to do the sacral deviation test again. Lift your right leg straight up. Look at the difference. You see the difference? Can you feel that, Will?
Mm-hmm.
Okay, do the same thing on the left. Oh yeah. Now it's balanced out. So that's objective proof that the adjustments I just did on him have been successful in realigning his pelvis and his lumbosacral spine. Now I'm adjusting his cervical curve, starting at C3-4, C5-6, T1. Okay, now I'm going to bring his head up over his shoulder. Turn on your back, please, sir. When you treat as many military men as I have, you want to be as nice to them as possible, but sometimes I have to get fairly aggressive with some of the adjustments. Okay, now put your arms straight out to the sides, palms facing up for me, please. I'm going to adjust this sternoclavicular joint right here. There you go. Good. And then your costosternal joints right here. Bet you never had this done at physical therapy.
Yes, sir.
Good, okay. Now I want you to relax your hands on your tummy and just let me have your leg. There you go. You should have felt that in your knee all the way up to your low back, did you?
Oh yeah.
Good. Okay, this is how we're going to... He's got 2 bad medial meniscus tears. There we go. Said they were so bad they couldn't even do surgery on them. Okay. So let's redo this Fabry-Patrick test now. Does this hurt as much as the first one did?
No, not even close.
Okay, good. Let's redo this left Fabry-Patrick because this is your bad hip. It's probably still going to be a little sore.
It's a little tight, but...
Not as bad as the first time? Good. Okay, let's sit you up and face this way. That way. There you go. So, he's had problems with his left sternoclavicular joint and AC joint. So I'm actually, and he has a lot of crepitus, which is grinding in the joint. So I'm going to adjust his left shoulder first. That's perfect. And then we're going to do his right shoulder. Yes, sir?
Oh,
yeah. I told you, crack addicts were going to love it. Okay, good. You remember the test we did with your neck where I had you close your eyes and bend your head forward and backwards?
Mm-hmm.
Wait till we get done adjusting and feel the difference on that one too.
All right.
Okay, very good. So you haven't seen anything yet. Come over here. I want to have you lay on your back with your butt right here and head up that way. Very good. Relax your hands on your tummy there. This is going to feel really tight, Will. There you go. Now just let your legs bend and relax naturally. This is how I want you to start sleeping at night. Flat on your back with no pillow and your legs propped up. Like put a clothes basket in with a pillow on top of it and duct tape it, or one of those plastic storage boxes that you store clothes in.
Okay.
To put under your legs where they're at parallel with the floor. So if you were to go home and lay on the floor and put your legs up on the couch and lay flat on the floor with your head all the way back, that's how you should sleep at night.
Okay.
That'll help your back and your hips and your shoulders, by the way. So I want you to keep your teeth together. Breathe through your nose. There you go. Yes, sir? That probably felt like a bomb going off.
Yeah, this one.
You're still kicking, you're all right. Actually, you had better reflexes following the adjustment. Okay, let's let your head drop in my hand. Perfect. I still got one over here. I can feel it, C6. There it is. Perfect. Yes, sir? And you're probably going to feel some soreness after your very first one because I broke loose some fibrotic adhesions and scar tissues in around your joints and your disc. Okay, let's kind of turn sideways and sit up. Push yourself up, yep, and stand right here in front of the mirror for me again.
All right.
And I'm going to have you close your eyes and bend your head forward and backwards for me again. Much better range of motion already.
Oh yeah.
Yep, take a look in the mirror right now. See how you're more centered?
Mm-hmm.
Your hands are a little further back, but they're still out in front of you, so this is your homework exercise.
All right.
You're going to lift your shoulders straight up.
Okay.
You're going to pull them back simultaneously like this with your rhomboids. Flare these guys back here like this. See, your head's forward, so we want to bring it straight back.
Okay.
Now I want you to look at the wall behind you. Full extension. I'm going to adjust your atlas on the x-axis to send a barrage of neurological proprioceptive bombardment into your cerebellum and the hindbrain. Now, this should, you tell me though, when you flex your hip forward and backwards this time, tell me what you feel different than the previous times.
I mean, it doesn't, there's no pulling, there's no
Restriction?
tightness or anything. Yeah.
Feels freer?
Mm-hmm.
Feel like I put a little WD-40 in there?
Yeah.
Good. Well, you've had physical therapy before for all these issues, right?
Mm-hmm.
So what would you tell our YouTube viewers about your very first chiropractic experience? Because this is your first time
yeah,
going to
this
a
is
chiropractor.
my first one. thought about it for years, done physical therapy for years.
Been to the VA for years.
Been to the VA for years. You should absolutely
Did
go.
anybody examine you like I examined you?
No. A lot more in depth, a lot more thorough. Everything from the questionnaire, everything from the hands-on. So,
good.
Definitely recommend going to a chiropractor.
Do you feel better than when you walked in the door?
Oh, absolutely.
Okay,
absolutely.
Good. Well, we're going to have you back. We're going to do it again.
Yes, sir.
All right. Thank you for doing the video for us, Will. This is your Houston chiropractor, a ChiroTrust member in Houston, Texas since 2012. We'll see y'all soon.